A very common condition, especially in Indians and Asians, I would say, is keloids. Now, what are keloids? Keloids are nothing. Something I always like to explain my patient is their overreaction from your own skin. Whenever we incur an injury in the form of a fall or a surgery or even just acne or even a small scratch, our skin tries to heal. But in case of keloid, the healing doesn't stop when it has to stop. It goes on. There's a continuous formation of fibrous tissue or the healing process, forming a thick tissue called keloid. Now, once a person has a tendency, so it is something in your own skin or genetics. It's not something which you can acquire, or it's something not which we can cure. So once the keloids are formed, the treatment is quite challenging and difficult. Again, I would like to stress there's no permanent cure for these keloids. Now, depending on the keloid, its location, size, we have different treatment options. One in the form of non-surgery, wherein we are giving some steroid injection within this keloid to reduce or to tell the keloid to stop forming. Hence, the thickness of the keloid will reduce. This injection are typically done in 2 to 3 weeks duration. One may need up to 6 to 10 sessions to get a control on this keloid. Another treatment would be non-surgically. We will ask the patient to apply something called silicone gel sheet. Now these sheets are occlusive sheets which need to be applied on the keloid scar. For the more number of hours, the better the result. So even up to 24 hours a day, other than your bath time, we ask the patient to apply this. Now these really work well when the patient approaches us early after the scarring. That means within 1 year of the scar formation, these treatments really have some good result. Other than this, we can also try some CO2 laser to reduce the thickness of the keloid scar. But in many patients, the keloid is so huge, the bulk is so much, these injections will be meaningless or useless. So in this patient, we go ahead with excision or the removal of the keloid scar and suturing. But with the clear understanding that once we operate, which is again an injury to the skin, the keloid can recur. There's no way anybody in the world can say keloid will not recur after a surgery. So we do certain precaution to reduce the recurrence rate. If I'm doing a surgery for keloid, post-surgery, I would immediately advise patient to use something called compression therapy. Depending on what area, we'll give different type of compression. Also, after 2 weeks of the surgery, I start calling that patient in for giving some steroid injection even before the keloid has formed as a precaution or a preventive method. In certain cases, when the keloid is very extensive, it is causing lot of pain, infection, smell, especially in case of the sternal area, we may go ahead and remove the entire keloid and cover it with the skin graft along with radiotherapy so that this keloid does not occur. So for keloid, they need to be multiple kind of treatment. Persistently, you may have to recurrently go to the doctor, and only then we can get a control of this keloid. If you have any more doubts about keloid, please contact us at Pink Apple Aesthetics.